Hi everybody, here with the next ultrasound video. I feel a little bad because this one doesn't have a resident associated with it, unfortunately, but this is a rare, important finding that I don't want anyone else to miss. So I was asked to evaluate a patient with a lump in her groin that was painful and getting bigger. Common things being common, we used the ultrasound machine to look and see if there was an abscess or fluid within this lump. The patient's story didn't really fit very well with an abscess though. As we look through this video, we see a large circular structure, and it almost looks like there's an intramural hematoma in the middle of it. We see a hyperechoic irregular area around the outside of the circle, and the inside of the lumen appears anechoic. As we continue to fan down more distally, we'll see that this large fluid collection is associated with the patient's femoral vessels. One of the most important parts for any soft tissue ultrasound is using color flow Doppler to make sure there's not any internal flow. When we place this over our fluid collection that we found here, we see that there certainly is flow. This leads us to believe that this is some sort of abnormal blood vessel. We see a bit of a unique pattern with our color flow Doppler here. It almost looks like one half of the lumen is blue and the other half is red. This is known as a yin-yang sign. This is what we see when someone has a pseudoaneurysm. You're typically going to want to save a still image of this and record the size as well. These are most typically found after a cardiac catheterization. Large pseudoaneurysms like this will need a vascular surgery consult and are oftentimes fixed by direct thrombin injections into the pseudoaneurysm, or if they're even more complex, may need a surgical repair. This patient was hemodynamically stable and was able to follow up with vascular surgery on an outpatient basis to get hers fixed. The whole point of this is to show how important that color flow Doppler is, to show you guys this is not an abscess, and you certainly don't want to go cutting into it. Alright, that's all for now guys. Thanks for watching.